Hi Rob, how are you doing?
Good afternoon, Rohit. It's a pleasure to be here with you.
Likewise, Rob. I think it took a while to get here, but now that we are here, super exciting. We'll do a quick intro for the audience for the podcast, and I'll just start with mine, and then mostly you'll be doing all the talking.
Sure.
So I'm Rohit Mahajan. I'm the managing partner and CEO at Big Rio and Demo Consulting, and also the host of this Big Unlock podcast, which has been, very popular for the past so many years. And we are continuing to build on the tradition that Paddy Padmanabhan, the founder of Demo Consulting, had started. So many healthcare leaders have been on this podcast, and it's great to welcome you here. And over to you for your introduction, Rob.
Terrific, Rohit. Well, it's a pleasure to spend time with you and with your audience. I'm Rob Posner. I'm the Chief Technology Officer for AbsoluteCare. I've been with AbsoluteCare for about 2.5 years now. And I joined AbsoluteCare because of the game-changing mission of this organization. And I'll get into that in a moment. I'll just kind
Yeah.
of give you the brief background. So prior to starting with AbsoluteCare, I worked for the last decade in similar private equity-backed funded organizations, which are provider centric and that are changing healthcare. And so the mission and the passion that I have for healthcare was really about the transformation that's needed, not just for those organizations, but for the country and for the world. I really believe in it, and I believe that we have the real opportunity and that technology plays a great role in that. And that's why I decided to move into the healthcare industry. And prior to that, I pivoted from hospitality and entertainment. I live in South Florida, and the cruise lines are big there. I've worked
Yeah.
with major cruise lines and Disney parks in particular as well.
Awesome.
I built a team and worked backstage at Disney parks where we built My Magic Experience, developed major aspects of that global rollout, transitioning to an experience, a managed experience for Disney parks, and really one of the first players in the idea of experience economy and leading products and services by experience, for their guests and for consumers. So
That's awesome. That's awesome, Rob. I'm a fan actually, and I think mention to you last time that Disney has a university where they do programs on leadership and quality and service and
absolutely,
couple other topics. I've been through all four of those.
is that right? Oh,
Yeah,
that's that. They have a wonderful program. They're world
yeah,
renowned for that.
yeah, absolutely. So great to know that now that you are at this healthcare organization. Could you tell us a bit more about you know uh, about Absolute Care and what the business model is and how, as you said, it's provider. You've been with provider centric, such like organizations, and they're game changer for the healthcare industry. So yeah.
Absolutely. So, Absolute Care has the mission to improve the healthcare of the nation's most vulnerable.
Hmm.
And we do that by improving outcomes through holistic care and care management of our members. So they're members to us, patients, how you usually refer to them in the industry. The reason we call them members is because we contract with payers for a panel of their members. And so they
Hmm.
become our members and we have responsibility for them.
I see.
So our tagline is Beyond Medicine, and that's because we deliver primary care, care management, pharmacy, and behavioral health, and deal with social determinants. And we do this in a comprehensive way. And so this really differentiates us from traditional care. And it's a full risk value-based model that demonstrates improved outcomes, and we're responsible for that. So we have to do really, we're responsible for the triple aims of healthcare, and
Yeah,
we're on the hook financially for that as well. We don't just talk about it, but we're committed to it, and we need to provide those results in order to be an ongoing and profitable organization.
that's
Um,
awesome. And I understand you are in several markets and tens of thousands of patients now. So there must
that's
be
right.
some early learnings.
Absolutely. So we're rapidly growing. We were in 7 markets at the end of 2024. We've grown to soon to be 11 markets in the next couple of months here. So we tens of thousands of members, high acuity, high utilization managed Medicaid, which is really critical to understand. So this is the nation's most vulnerable that have chronic disease states and are, have many social determinants of health issues that compound their health issues. And really, we need to address all those things in order to be successful.
That's awesome. And I understand what's the delivery model? It's partly, I think, in the centers that you have and also in the community, right? So that must be something unique that AbsoluteCare brings to the table.
Absolutely, Rohit. So we deliver our care about half in our centers and
Mm-hmm.
half in the community environment. And that's really important because in every one of our markets, we have a center in the urban core to service our members. But frankly, sometimes it's not easy for our members to get to us.
Mm-hmm.
And we are responsible for our members. So it's upon us to go to the members wherever they are to make sure that we're delivering care and care management so we get successful outcomes for them.
That's amazing. So I have a curious question actually, just from my perspective. That and Rob, hang on, just 1 second. Sorry about that, Rob.
No worries.
Quick, yeah. Okay, so the curious question is that you mentioned that you get the cohort of the patients from the payer side, right? Because they obviously want better outcomes for the patients. So how do you work with providers at all?
So our organization has providers. So in other
Okay,
words, we do the actual care. We are providing primary care services um, through our own employed providers.
I
We
see.
then also have the care management teams that are employed,
Right.
behavioral health specialists, pharmacists who are delivering in our pharmacies, et cetera. So we provide that comprehensive care and care management in the center. And we also have providers and care management teams who go out into the communities to deliver that care as well in the members' homes and in facilities where we find them.
Great, great. So, so I understand that, there's a lot of technology at play here. Obviously, we are all leveraging all kinds of technologies to help better outcomes for these members and for these patient populations. So would you please talk to us about your journey? Like, how was it when you got here at AbsoluteCare? And then how did you fast track? Like, I think you were talking about fast tracking
Oh,
transformation.
absolutely.
Yeah, yeah.
So I'm the first C-level IT executive in the organization, and not surprisingly, that means that usually there was coming into it, I think the teams were doing the best they could with what they had, but they didn't have a seat at the executive table, and so we found that the state of technology was not where it needed to be, and of course that's why they brought in a chief technology officer. So nothing was really surprising from that perspective, but systems were not configured for our mission. So I mean, it's not unusual because systems are not really made to, or designed. Typical EMRs are not designed for value-based care, a full risk type of provider models, right? So it's not surprising that they were not configured correctly. The technology team was following the business rather than leading. There was a lack of appropriate governance. And like I mentioned, the teams were working really hard and I'm proud of the work that they did to get to that point. But clearly the organization recognized that there was more that needed to be done. And just to kind of explain the point, when I got there, within a month or so, we had a terrible situation where we had a significant outage of our EMR. And that went on for more than a day. And no one in the organization thought to tell me that our EMR, which all of our providers and care
Yeah,
management teams count on to do their job every day, they should
yeah.
let me know that we're down. And
Wow.
so it was the thing where we had to change the culture, we had to change expectations,
Mm-hmm.
deal with accountability. And so that's kind of the start of that story of saying, okay, that's where we were, and
Mm-hmm.
recognizing that, I installed new leadership within my department, get
Mm-hmm.
people who understood, where we need to go and how to set those expectations for our teams,
Mm-hmm.
reset what it means, operational excellence means, and establishing that culture of
Mm-hmm.
accountability. We worked very rapidly to start reconfiguring our EMR. And even in terms of the governance, like we had a steering committee for our EMR, but what we found was that we had a whole bunch of leaders sitting on calls, which really should be about the strategy, and they were dealing with day-to-day issues, which kind of pointed to the fact that we didn't structure our governance and having core teams and the right people dealing with the day-to-day issues so we could address those, and then separately deal with things like, should we be moving to the cloud? Should we be on one instance of this EMR? So these things have to run in parallel, and you have to have the right people engaged in those conversations in the right cadence. And so those are some of the things that we had to do very quickly in order to start dealing with the rapid transformation that we need to make as an organization.
Right. And I also remember, Rob, from one of our previous discussions that you really had to do ground breaking, or, from grassroots, you had to build a care management system because, the EMR really is not suited for that purpose, right? So please talk to us about that. Is something very different, I guess, you have done in the organization, and, it's kind of like the bedrock for the engagement.
Absolutely. And so, just about all EMRs you could categorize as their focus is on delivering care. It's about the visit in the office, in an ambulatory environment. And what does that mean? For a patient visit, a member visit in a center. And that's really what it's designed to do. When you talk about all the work that we need to do to provide longitudinal care for that member, it's the things that are happening the 99% of the time that they're not in the doctor's office, if you will. That's the care management responsibility. And that's where a lot of the results and the outcomes for our patients happens. But it's not really addressed in these EMRs. And EMRs look at that like decision support for the doctor, making sure that they're covering care gaps and things like that. But care management is its own animal. They have their own workflows. And we need to make sure that they're focused on the most important things that produce outcomes, improve outcomes for our patients. And so to that end, we determined that the EMRs don't really do that. And so we decided to bring in a full-fledged care management system. And we implemented that and went live with that about a year ago, and integrated that with our EMR, which at the time was a fairly significant thing to do, so that our objective is that people are working from one pane of glass, that if they're in the EMR, they don't need to go to the care management system to check on something, and vice versa. And so that's a journey. We've done that first couple of iterations of making that work. There's more work to be done, but we've gotten our MVP product into the hands of our markets, and we're using it successfully. And it's been a great story of success of showing how we can integrate care and care management that more demonstrates the model that we have. So we have a care model. We need to make sure our systems are aligned with that care model, not making people try to work within systems the way that they are.
Absolutely. No, that's a significant effort, Rob, I think, and as you said, it'll always need to be, taken to the next level, based on the user feedback, and the people who kind of engage with it. So talk with us about, like, what are some of you said, let's not forget the small things in one of your comments, right? So
I did. I did want to I want to back up for a second. So I want to finish with the problems first before we talk about some of those solutions.
Let's do that.
Let's go back to after we talk about the care management side. I think the tech stack is important. I don't know if you want to prompt me on that.
Yeah, sure.
Talk about, in other words, we have center and home-based part of the model. And then there was a big technology shift that we needed to make for that. So if you want to
let me
run back to that.
Yeah, so backing up. So I think we talked about care management, Rob, and that it's fantastic that you were able to build the product, to engage the members and also to support all the stakeholders in the organization. How did you think about the tech stack? Because you are operating at two levels, like we discussed before. So at the center as well as in the community. So
absolutely. And from what I've seen in the industry, right, I think that typically it's kind of like I mentioned about the EMR. These systems are designed to either work in a facility, an office, or a hospital, or kind of hospital at home in a member's home. So it's kind of like, you expect the technology to stay in one place, if you will. Someone is a remote worker, someone is working in the hospital, someone is dedicated to providing technology, hospital and home. And really, in our integrated model, that's not the case. We're delivering half of our care and care management in people's homes, but that means that our workforce is mobile, and they're actually in the field, moving between members' homes. We have transitional care managers that are actually going out into facilities when our members, when we get an alert that a member has been admitted to the hospital, or we get an ED alert. So in other words, we need to have systems that can work in a connected fashion across a myriad of different environments. And so our tech stack was not made for that. Right? It was made for these kind of more stationary environments. And so we had to relook at that entirely. We tested out different laptops, we tested out different connectivity solutions, different carriers, until we found a solution that would work. And then we looked at each market individually, since different markets are going to respond differently to the carriers. And we came up with a great solution of having new high-powered laptops, MiFi devices, and iPhone 15s, which really, it ended up that 5G technology, and specifically the antennas on some of that technology, which allowed us to break through some of the earlier phases of those type of challenges. And so 5G really starts to open up that capability and give you the bandwidth that you need in order to connect to an EMR when you're in the field. And once we did that, I mean, it really unlocked the power of our solution. And I saw that firsthand when I rounded with our transitional care managers in one of our markets. It was really great to see. We went with the transitional care manager at the bedside for a member who'd been admitted to the hospital. And what the transitional care manager is there to do is to start coordinating care and the care management, making sure that they establish and schedule a follow-up visit with members so we can continue to take care of them. And I saw it that they're interacting with the member, and then they're able to open up the EMR right there at bedside, schedule that appointment, confirm that with the member, and then know that we're going to be able to provide that continuity of care as that member exits the hospital, and we need to make sure that they continue to follow their care plan. So we're really seeing that in action. We're seeing that the technology is working and makes a difference in the care and care management that we can deliver to the patients.
That's awesome. Yeah, being able to schedule appointments at the bedside is fantastic. Even today, to reschedule my appointment with my physician is a big task.
Absolutely, it is.
So tell us, Rob, that in building all these, solutions to solve the problems that you saw, how did you go about the governance aspect of it?
Yeah, governance is a really important aspect here. It's really easy to kind of focus on what system did you use, and there's great enterprise solutions for most of the challenges that we have in healthcare, at least broadly speaking, right? We have our in-house pharmacy, so we've implemented a pharmacy system. We have a care management system. We have our primary EMR, and so we have the big tenants, if you will, for the clinical applications. But what's really important for us to unlock the value for those systems is making sure that we established proper product teams, making sure that we had steering committees that were effective. We established intake management, because it's so easy to go get lost in all the new requests that are coming in, and how do you manage that? Making sure that we stay aligned with the business in terms of the overall strategic plan, as well as the day-to-day changes that are happening. And so kind of you have to manage between the strategic and the tactical. You can't just do one or the other, or you won't be successful. Keeping that executive alignment by engaging the appropriate executives at the right times, and then having an overall change management and governance approach. So those are all, key blocking and tackling for governance. If you don't have these things, it doesn't matter what systems you put in place, you're not going to be successful. And I think another point, which is not governance in particular, but I'll just call it part of the don't forget the small things. Like when I mentioned before about the community tech stack, one of the things that we didn't think about, and by the way, you got to pilot everything. Don't go live with these things without piloting, because that's where you learn the small things that make a difference. So for example, we provided all this technology, but we didn't have the right type of briefcases for the care management team. And until we got them rolling bags, and they had to be locking because of PHI, and we're a high trust certified organization, which is business critical to us. And so we take that very seriously about how we handle patient information.
Yeah.
And so, those are the kind of things that made a difference. If you don't take care of those little things, you don't get the adoption, and then you don't see the business results, which is why, at the end of the day, you got to think about the big things, you got to think about the little things, and that together is what makes a solution really work for the organization.
That's great. So, Rob, no podcast would be complete without touching upon AI, right? And innovation. So, would love to get your thoughts on innovation, AI, and now, Gen AI, of course, what you're thinking, and what are some of the use cases that you might be coming up with. What is your thoughts on this?
Sure. Look, AI is a really exciting topic in the
Mhm.
industry, and for us in particular. I am really excited about what we've been able to accomplish recently, and equally excited about the opportunities in the future. So on the clinical side, rolling out ambient experience, ambient listening for clinical notes is the critical use case. We've been able to implement that successfully. We went from pilot very rapidly to full rollout. We saw the results very quickly. And look, there's a lot of change management to do with the providers to get them used to that fact, this ambient listening device, making sure that they're talking to the patients about this and what it means, and how to leverage that effectively. And so that's a learning process, and we're definitely still going through that, but we're already seeing the results. And one of the immediate results is that our providers can engage our members more effectively, right? And so at the end of the day, they're spending less time hands on keyboard, more time engaging with our members, having the important conversations that they need to have to deliver care. And so that's really exciting about what we're going to see in terms of the impact on care delivery and outcomes. And so I think that's probably the most important thing. Another piece on the clinical side, we implemented a system that detects diabetic retinopathy with fundus cameras. And the solution, we take the images in the office, it immediately sends those to our partner in the cloud. They do a read of those images and send back in almost within 30 seconds a result and a recommendation for referral. And so what we're seeing is, because of the fact that we get that instantaneous result, that our patients, our members, are actually going forward and getting that with the referral and going to that follow-up appointment. And that's really what we're talking about, is we're changing the behavior of our members to the better, so that they get better outcomes. So they address diabetic retinopathy at an early stage and get that taken care of, so that it doesn't, because it could lead to blindness. And it's a really urgent issue. And so here we have technology that's really motivating our members to take care of their health. That's amazing and exciting to see that happening. And then additionally, we're starting to see AI throughout all of our systems. That's just almost happening organically, I would say, just by the vendors just providing it. So certainly Microsoft Copilot, which has become pretty ubiquitous. We've rolled that out. We piloted that, saw great results, saw great adoption. And I'd say from all the technologies that we've released, and I'd say Copilot was one of those ones where we put it out there, but there was no requirement to use it, right? Unlike if we roll out an EMR, providers are required to use it. We provide them detailed workflows and training and observe the results. With Copilot, we just kind of put it out there, gave them some training, gave them some tips and tricks, and all of a sudden the uptake on that was amazing. So we're seeing great results in terms of productivity, and people starting to learn how they can use AI within their day-to-day in the business. So, and that is, recently rolled out. We expect to do a lot more with that. We're continuing to do workshops to enhance the learning and knowledge of our staff for what's the art of the possible with AI. And so those are things that we have implemented so far. Those are active in our organizations at the enterprise level. In terms of where we go from here, there's a couple of areas that are very exciting to us. Robotic process automation, though it's not a new topic, is an area where we can continue to refine the EMR experience for our providers, our frontline staff. And so we continue to look at automation opportunities. We'll continue to look at other AI capabilities within the EMR to do things such as create patient documentation and note summarization for our patients, to be able to translate into new languages for our patients so that we're better communicating with them. And also looking at the multi-click environment of our EMR and how can we reduce clicks by automating routine tasks. So that's something that we're going to continue to look at. I think the next area, though, is really AI agents. And what are the things that are happening outside of our core platforms that could be managed with additional automation and bringing together of technologies so that we can free up our team members to focus on our members.
That's awesome. That's awesome. I think we did one seminar today, Rob, in fact, on agentic AI in healthcare, and there was a very good response, to the webinar, because it's a very interesting topic. People are looking for use cases. So we've unearthed several use cases with our clients, and definitely we think this agentic AI is, in parallel to RPA, is one of the options to explore. So I think we are towards the end of our podcast, Rob, here. Any other closing remarks or thoughts or any information that you would like to share with the audience in closing?
Yeah, I would just say that it's a really exciting time to be in healthcare technology. I believe that we are definitely at this a point of inflection where not only do we as healthcare technologists see the opportunity, but the business definitely sees the opportunity and needs the technology component to step up in the business.
Yeah.
And I think that's going to happen as executive leaders not only expect that from their technologists, but also expect the business to be thinking about technology opportunities and how we can leverage it. I think that'll create the opportunity for the business and tech function to work together to solve problems for the business.
Great. Thank you, Rob, for all the insights. Really appreciate it. And now I'll just close the recording.
Thanks, Rohit. I appreciate the opportunity.
Likewise, yeah.